Assalamualaikum warahmatullahi wabarakatuh. Welcome back to my YouTube channel, Aiman Story. Here it's me, Aiman. Today I would like to share with you about this kind of symptom known as anosmia. Okay, anosmia or loss of smell that is present for those COVID-19 patients. Okay, so from the statistics given, there are about 55% of those COVID-19 patients experience anosmia or loss of smell for all transient period. It means that once the COVID-19 disease is run out of the course, so the symptom of anosmia will be away from the patient, from the former patient of COVID-19. Okay, based on this research done by several researchers all around the world, there are several human organs that have a certain expression of this receptor known as ACE2 receptor, okay, and also transmembrane serine protease 2. Okay, this ACE2 receptor, known as angiotensin converting enzyme, is the most available receptor in heart, okay, lung, kidney, liver, and blood vessel. Okay, so for this kind of infection caused by COVID-19 or SARS-CoV-2 virus, okay, the SARS-CoV-2, okay, will have high expression and will attack certain organs, for example heart, kidney, and also liver, blood vessels that are having high expression, okay, high expression of ACE2 receptors. Okay, once there is a high expression of ACE2, they will give the high probability of COVID-19 virus infection. Okay, so this kind of expression of receptors that are possessed by those organs are the most susceptible for the COVID-19 infection. Okay, how we want to know that the process of this kind of COVID-19 infection will cause the process of the smell, okay, the sense of smell will be lost for a transient period of time. Okay, here is the nasal cavity. Okay, nasal cavity. Okay, once nasal cavity, and there is a bony plate. Okay, bony plate, and then this is brain. Okay, and then this one is a olfactory bulb. Okay, from this olfactory bulb there is a sensory neuron that is passed through the bony plate, and then it will reach to the olfactory epithelium. Okay, this kind of olfactory epithelium is placed with other supporting cells like globular cells, okay, and then microvillar cells, and so on. So this kind of supporting cells will help the hemostasis of the function for this olfactory sensory neuron for sense of smell. Okay, so once someone, okay, inspire the air, okay, this one is air that are present SARS-CoV SARS-CoV-2 virus, okay, in the air. So there is someone who inspire this air containing this kind of virus, okay. Then it will, those virus will go through this nasal cavity, and then it will bind to the sense supporting cells, okay. It will go to the supporting cell because of what? Because from the previous research done by the researchers, there was a report that those kind of supporting cells, okay, expressing the ACE2 receptors, okay, ACE2 receptors. So once the tissues or human organs having this kind of receptor, so the susceptibility of SARS-CoV-2 virus or COVID-19 virus will tend to attack those cells or those organs, for example. So as a result, the supporting cells, okay, the supporting cells that are placed next to the olfactory epithelium, okay, will get effect for its function as a result of the COVID-19 or SARS-CoV-2 infection. So what's the result from this situation? So it will stop, or it will reduce the homeostasis, also the function of the supporting cells, in order to support this kind of olfactory epithelium cell. So because of olfactory epithelium cell has a have a olfactory sensory neurons that attach to the olfactory, okay, olfactory bulb. So the sense of smell cannot be processed through the sensory neurons or olfactory bulb and then go to the central nervous system to be to be read by the brain as a sense of smell, okay. So this kind of situation happen for those COVID-19 patients that are experiencing this kind of symptoms, anosmia, okay. Anosmia means loss of smell, okay. So this kind of symptoms actually is just transient, okay. It means that once the COVID-19 run off its course, so the former COVID-19 patients will be no longer to have this kind of symptom, the anosmia. So and then those supporting cells, okay, after infected by the COVID-19 virus, the regeneration or the rejuvenation of those supporting cells will be activated, and then it will help and assist the olfactory sensory neurons for the function in in sense of smell, okay. So that's a brief explanation why COVID-19 patients have this kind of symptom known as anosmia after infection of COVID-19 or SARS-CoV-2 virus. Okay, I hope that's helpful for your gaining knowledge on this kind of COVID-19 educational series regarding to this quick info on anosmia. Okay, so anosmia and also COVID-19 is interrelated. So about 55% of COVID-19 patients are having or are experiencing this kind of symptom, anosmia. So I hope it is helpful, and I will give you some additional knowledge on this COVID-19 infection. Okay, thank you. So I hope my subscribers will like, okay, like, share and subscribe my YouTube channel. Okay, thank you.